Hi, I'm Anushka. Today I want to tackle just a small part of what it means to be BAME when it comes to breast cancer. BAME stands for Black Minority Ethnic Group. This is anyone who doesn't identify as being of white ethnic descent. Ethnicity, what does it mean? Well, it's all-encompassing. It classifies a group of things like language, diet, lifestyle, religion, physical features, anything that creates a sense of belonging for that person in their community. In the UK, about 13% of people identify as being from the BAME group. Now, why is it important when it comes to breast cancer? Well, evidence about the BAME group, specifically in relation to cancer and the way they access services, has historically not been fantastic. It's getting better, but there's still a long way to go. Now, the reason this is important is because we need to be able to understand the needs specifically for the BAME population in order to understand what services need to be aligned towards them. For example, there's evidence that there is a lack of appropriate written information for the BAME population in the different languages. There's a lack of uptake when it comes to breast screening. The BAME population are less likely to access cancer services. They're less likely to see their breast nurse after a diagnosis. There's a huge discrepancy in the provision of wigs and prosthesis, which are not skin tone specific to the BAME population. There is less support groups specifically again for their culture and their needs. And South Asian women report a significantly higher proportion of depression when it comes to a diagnosis of cancer than do white British women. Being an Asian woman, I wanted to try and understand where some of these myths and misconceptions about a cancer diagnosis come from that might stop them approaching their GP or limit them from understanding what could be going on with them. There is evidence that in the South Asian population, women can believe that a cancer diagnosis is something that has been bestowed upon them by divine power or a curse. They believe it can be caused by trauma to their breast, a negative lifestyle. They believe a cancer diagnosis is automatically associated with a death sentence, and all of this causes a huge amount of fear. When we couple that with the lack of information out there for the BAME group, you can understand why then that divide becomes even further. We know also in these societies that most people won't talk about a cancer diagnosis, let alone being ill in the first place. So we need to start to learn how to understand where they're coming from in order to help break that taboo, to start having those uncomfortable conversations, not only with our friends, our family, but our relatives. We know that cancer incidence increases as we get older, so this isn't a disease of just young women. I spoke to one of my patients and now friends, Brenda, who's helped try and understand what her perceptions were when she was diagnosed.
Lo and behold, I was very surprised. I had Shani with me at the time, who was then 16, and I was told right then that it was cancer.
Okay.
And of course, I broke down in tears because we didn't speak about that sort of thing. Nobody in my family had cancer. There was no need to speak about it. And the little that I had heard about cancer is that it's a death sentence. So I just had, I believe JJ was quite young at the time. My son was, so I just thought, well, that's it. I'm not going to see him grow up.
Yeah.
Yes. So
Wow.
the expectation wasn't, I didn't have any explanation. I was told, do you understand? And I said, yes. And I remember leaving, just wanting it out and just thinking, I want it out. Until I was, I had friends and family who came and spoke to me and said, look, we're going to fight this together. So, yeah.
When it came to your diagnosis, what were your first thoughts about telling your wider family back home?
Yes. So that was, that was the big thing for me. I couldn't tell them because already I was thinking that it was a death sentence. So if I told them, they would just agree to that. And it was not just my wider family back home, it was also my friends. And funny enough, in the church where I was going, I couldn't say, and you would have thought that it would be the people you could talk to.
Yeah.
I could not talk to them because I did not want that death sentence to be put on me. And so I thought, if I think of it positively, and the people around me, like my husband, was thinking positively, and then I can fight this.
Okay.
And so I felt that I had to hide it, basically.
Gosh, wow. You said the word death sentence a few times. I hear that a lot from speaking to some Indian relatives or friends, this death sentence word. Do you think that's a kind of thing that's ingrained from when you are younger? Because there are not many people you know, or people don't talk about it in society?
Yeah, I mean, it's definitely, I mean, when I think about it, and now that I have been diagnosed, when I think about it, there are a lot of people in the Caribbean that has got breast cancer. But it was just the same thing that I did, hiding it. I think they did the same thing. And
Yeah.
so, I mean, I will never, I mean, I told my youngest now, and I would speak to people about it and say, yes, I have been diagnosed with breast cancer, because I think people need to know, and it's not a death sentence. You know, I'm still here.
No,
Um,
absolutely.
we need to stop hiding it and let people, make people aware of breast cancer and how you can deal with it.
Oh, absolutely. How do you think that we can help? I mean, sometimes I think it's a lost cause for the older generation. We know that breast cancer incidence increases as you get older. You know, about
Yeah.
85% of people are over the age of 50. Yet when I look at the amazing BAME support groups, they're all founded by young women who feel so aggrieved by the lack of services that they've started something up. But we're all into that cool Instagram social media side of things, and that's great for the younger population. How do we get the message to older women? How do we start a dialogue?
I think I think, you know, you've mentioned it. Social media is a very good thing if we use it correctly, and that's where young people are. They're based on social media, and so we need to teach them. It needs to be something that we speak about, without being scared to tell people, well, look, I was diagnosed with breast cancer. I remember there was just the one person that I ever knew that was diagnosed with breast cancer, and it was Kylie Minogue. You know, because I used to follow neighbors, and then I used to follow neighbors so well that I remembered that she was diagnosed, and I started telling myself, oh, but you know, she was quite young when she was diagnosed, and look at her, and I remember thinking that. And so if you have people that you can look up to, that you can think, oh, well, look, this person was diagnosed, you know about it. It's not a secret anymore. It's not anything that you have to hide. I think it's the way forward, is to use social media to actually show people that there are real people out there that's diagnosed with breast cancer.
And the power of, I guess, somebody with a name, somebody with fame coming out and speaking it's huge, isn't it? I guess it
Yeah,
just helps people
yeah,
feel like it is more normal, and anyone's susceptible.
absolutely. Yeah.
Can I
Yeah.
ask, I was reading some studies about studies from South Asian women, for example, who believe that cancer is something you can catch, or that if you've not been good in your life, it's something that's bestowed upon you by a divine power. Were there any of those kind of feelings in your community?
It's always been said though that black people didn't get breast cancer.
They think it's
It was
typical of white women.
yes. So I just thought, oh, what happened to me now?
No, that's interesting. Absolutely.
We definitely need to look at this, and let's stop pretending that we are, you know, it's something that it's a disease in the sense of you catch it, like you said, through someone else. It's so common out there now. Every other person that I speak to, they say the same thing. Oh, I've had breast cancer. It's good to know someone can talk to you and can say, look, it's not the end of the world. It's not that death sentence that everybody else is putting on you. You have options. You can speak to people. You can take your time. You don't have to rush like I wanted to. You
Yeah.
don't. There's no need to.
Yeah.
Um,
Absolutely.
and I think it's a good thing. Definitely stop hiding it. Stop pretending as if, you know, we don't catch it. Like I said, or it's not. It could happen to any one of us.
The key message we want to take home from here is we need to start to have those conversations about breast cancer, signs, symptoms, and risks. Have an understanding about accessing the screening programme, encouraging our relatives and friends to make an appointment to discuss that with their GP if necessary. To understand that a diagnosis of cancer is not an automatic death sentence, it's very treatable if detected early. To know that one size does not fit all. Just because there's a diagnosis of cancer, it doesn't automatically mean having your breast removed, a mastectomy, or having chemotherapy. Treatment is very tailored towards exactly the type of cancer you might have. Furthermore, we need your help in spreading the news, in getting that information out there.